technical issues. So she'll join us when she joins us. But Dr. Berger, why don't you go ahead and get started? Yeah, take it away.
Welcome and thank you for joining.
Sorry, all the doctors turn their camera. Okay, you guys all have your cameras on. Okay, sounds good. All right, go ahead, Dr. Berger.
Welcome. My name is Dr. Ira Berger, and I'm an internist and pulmonologist. I've been with this group for 28 years. I just first want to give you a little history of the group. The group was founded in 1952 by Dr. Stephen Jones, who was actually the first internist in Rockville. Our office from 1952 until 2001 was on the corner of Deers Mill Road and 1 block past Wooten Parkway, which is now a condominium development. We moved here in 2002, and in 2002, we actually started the process of transitioning to electronic records. We were one of the first practices in the area to do it, and by 2003, we're all electronic. When I joined in 1993, I was the 9th doctor. It was an internal medicine and pulmonary group, and over the years, we've slowly expanded. What's happened is whenever we found a good doctor of a specialty that we thought would add to our group, we would add them. We added rheumatology, we added GI, we added endocrine, we added dermatology, we added sleep medicine, we added nutrition, we added psychology, especially when we had trouble getting our patients into other doctors, or we had trouble with insurance that other doctors, like a lot of endocrinologists, for example, don't take insurance. So any doctor in our group takes, all doctors take the same insurance for the most part. Our group is multi-specialty. Our goal is to provide high quality care, to get people in as soon as they're needed, and to make sure that if your doctor is not available, that someone will be here to cover. We have Dr. Silverman is retiring in September, despite my pleas with him not to. He will be missed. And I know a lot of his patients will need to say, who should I see? Some of them have previously seen other doctors, but most of the other doctors in the group have very full panels. One of the reasons we wanted to do this webinar is we wanted to introduce some of the newer doctors. Our newer doctors are actually, for the most part, not fresh out of training, but experienced, but new to Rockville Internal Medicine. And I'd like to introduce them one at a time, have them tell themselves a little bit about their previous experience, where they trained, where they're from, and anything else they'd like to share. I'll start with our newest doctor who just joined us very recently, and it's kind of very difficult to start at the time of the pandemic, but she's doing a great job, Dr. Christina Council.
Hi, I'm Dr. Council. I'm originally from New Jersey. I trained in Delaware at St. Francis Healthcare. From there, I came to the DC metro area, was in DC at United Medical Center for a year, and with MedStar Health for 2.5 years, and just joined Rockville Internal Medicine, I think, 2.5, maybe 3 weeks ago. So very fresh, but excited to be here.
And Dr. Council is an internist in taking all patients.
Yes.
Then we have the shy and quiet Dr. Kharia Holmes. We call her Sherlock. Trying to get her out of her shell.
Dr. It's Holmes, a hard thing to do.
Yes. Dr. Holmes, would you like to tell us a little bit about yourself?
Sure. So my name is Kharia Holmes. I am originally born and raised pretty much in Houston, Texas. And then my parents kind of migrated north. I did my medical school training at Morehouse School of Medicine in Atlanta, Georgia. And then trying to get closer to home, I did my residency, internship, residency, and fellowship in geriatrics at Virginia Commonwealth University. And then after I finished all of that, I came back home and started working in Maryland.
Thank you. And she is also an internist taking all new patients. And then we have Dr. Pasindu Samarasinghe, who most people call him Dr. Sam or Dr. P. Sam. And he is also an internist.
Exactly. My name is Dr. Pasindu Samarasinghe. I'm from Sri Lanka, which is a beautiful small island to the south of India. And Sri Lankans tend to have very, very long names like mine. So generally, I tell my patients to call me Dr. Sam. I went to med school in Sri Lanka and then moved to America about 6 years ago. And I did my residency in Danbury, Connecticut. I completed 3 years of residency last year, and I moved back from my family to live in Maryland. So I've been at Rockwell Internal Medicine for about 7 months now. It's been fantastic.
Thank you. So what I'd like is I'd like each of the doctors to speak briefly. We'll start again with Dr. Council of their approach to medicine and if they have any specific interests in what they like to treat. And if a patient had to describe their style of how they practice medicine, how they would describe it.
Okay, so my style of medicine, I would say, is complementary. I like to work with my patients. So definitely not paternalistic or more of a dictatorship, but more so, I'll give my recommendations and ask patients, well, what do you think? And let's try to work together to have a great outcome. What else did you ask me?
How would your patients describe you?
As fun, of course. No. I think my patients would say that I'm compassionate, and enthusiastic, caring, hardworking. I guess that's probably about it. And what else? Oh, you said interests. So I like women's health, and any type of preventive medicine, of course, as a primary care physician, and hypertension, diabetes management, love those as well.
Thank you. Dr. Holmes, same question.
Okay. So I would have to say that my style of medicine is very much a partnership. I really believe that patients and I partner together to find out the best outcome possible for their health. So I always tell patients, you're the captain of the ship. I am the first mate. I will tell you that there is possibly an iceberg ahead. And if you want to sail into that iceberg, I will tell you why we should not go that way. And I will give you all of the benefit of my $400,000 of medical school debt, and give you all the information you need. And if you still want to sail into that iceberg, I will ride along that ship with you. And when we hit it, I will try to fix things. And so that's really how I approach things, because I believe that patients really should have autonomy in their care. My patients, if they could describe me, they probably say I'm fun, unorthodox, I like to think outside of the box, and I like to make patients laugh.
Thank you.
Oh, I'm just going to interrupt here. It sounds like we're getting some feedback from somebody. So if you're not actively talking, if you could try to mute your mic. So that's all the patients on the line for sure. If you could mute yourself. And then also one other comment, Dr. Sam, it was a little hard to hear you when you were on there. I'm not sure. You might be a little close to your mic, actually, if you could maybe try that. And it looks like Elshaday, our new nurse practitioner, has joined us. Can you just say something so that we can hear you and make sure your sound is good?
Hi, everyone. Thank you so much. I was having some Wi-Fi issues, so I apologize.
Okay. All right.
Elshaday, if you could introduce yourself, tell people about your background, and tell them what you do in our group.
Okay, sure. So I'm an adult gerontology nurse practitioner. I joined RIMG in February after doing one of my rotations from my graduate school with them, and I learned the culture, and I greatly enjoyed the patient focus center that they have, and I wanted to be part of that. My background is I've been a nurse for about 7 years, and I work mostly in primary care and cardiology. And then I went to the George Washington University for my master's in nurse practitioner school. So I see patients for acute and chronic issues at RIMG.
Thank you very much. Dr. Sam, if you'd like to chime in.
Right. My style of medicine is really building a dialogue with the patients, because I did my training in Sri Lanka, so we didn't really rely on imaging, CT scans, MRIs, none of that stuff. So it's really based on history with the patients and coming to a decision together. My areas that I'm really interested in, it's nephrology and infectious disease, mainly because my residency program, the program director was a nephrologist. So they got exposed and learned a lot of nephrology as well as infectious disease because we had some really good doctors there. Those are really, really my primary areas that I'm interested in.
Thank you. So what I'd like to ask next is if each of you, one at a time, could tell everyone listening, what are your interests outside of medicine? What do you like to do in your free time? Any hobbies, any interests, anything else about you that you'd like to tell them? Dr. Counsel.
I mean, I like to go to restaurants, different types of foods, things of that sort. Dr. Sam, we were talking about Sri Lanka. As I told you, my nanny's from Sri Lanka, and she actually just cooked us some Sri Lankan food yesterday. So any type of food from different cultures, things of that sort, I love it. I love spending time with my family, and I like doing game night. So if anyone's up for that, I really like doing board games and things of that sort.
Thank you. Dr. Holmes?
So being a single mom, my time is filled with my son. So for me, that is definitely a hobby and interest of mine. I also have started a blog and I'm actually in the process of writing a children's book that I'm looking to get illustrated and then self-published. So those are some of my hobbies.
Dr. Tano is a very talented artist, just so you know.
Oh, yeah. I've seen some of her artwork. I'm actually in the process of negotiating with her for one of her pieces for one of my exam rooms, exam number 16. But then we had this coronavirus, and so my finances had to
Understand.
back down.
Dr. Sam.
So I watch way too much tennis. I'm really into tennis. So that's pretty much what I do. It drives my wife nuts because tennis, unlike other sports, is an all-year event. Every single month there's something going on. So I'm kind of bummed right now because Wimbledon got canceled. So that's really what I do. And besides that, I watch a lot of TV shows. We're going through, I think, True Detective and something else that my wife watches. I also collect mechanical watches.
Mechanical watches?
Yeah, watches.
Thank you. Elshaday.
Right. My interest, I love spending time with my family, especially with my nieces and nephews. They're all between the age of 3 and 10. Whenever they're good, they come to me. Whenever they're not nice, they go back to their mom. So that's the best thing that I enjoy to do. I also love reading books, especially motivational books, and like to draw as well. I didn't know Dr. Tano. Maybe I can come and learn from you.
Well, given that it's the pandemic and given that we're doing social distancing and given that most people are spending most of their time at home these days, ourselves excluded, what I'd like is if each of you can give a recommendation for one or two things to watch on TV, movies to see, or books to read, whichever you like, that are among your favorites. Dr. Counsel.
Okay, I like to binge watch on Netflix. So I just finished All American. I would definitely recommend that. It's a series. The Pharmacist is another series, and Ozark. Those are probably my top 3 right now.
Thank you. Dr. Holmes?
So my friends like to say that I'm an old soul because I tend to go for the classics. So right now I'm binge watching a BBC or a British TV show called Father Brown. I really like that. I always am good for a good Murder, She Wrote mystery. So I tend to watch Murder, She Wrote. And Perry Mason is definitely my favorite lawyer. So I tend to watch that as well, which are all on MeTV, FeeTV, and Cozy.
Thank you. Dr. Sam?
So TV shows, I've got my top 3. It's Breaking Bad, The Wire, and Game of Thrones. Even though they kind of messed up Game of Thrones at the end, it's still really, really good. Right now I'm watching Tiger King. I'm in the middle of it. and it's pretty intense. I would recommend that.
Okay, thank you, Elshaday.
Yeah, I just started with Tiger King as well, and so far it's been very captivating. So that's something that I just started. But in terms of books, I mentioned that I love reading motivational books, and my favorite author is Brandon Burchard. So any book from him, I think it's life changing. My favorite is the Motivational Manifesto. It's pretty simple to read, but it really kind of force the reader to reflect on themselves and kind of have a positive perspective in life. So
Thank you. I was hoping someone would say at least one book, because otherwise people would think no one here reads. If anyone is listening and has any questions for any or all of the doctors, be my guest to submit the question.
Yeah, we do have 2 submitted so far, so we can, do you want to go through, do you want to do them intermittently, or do you want to do them more at the end, Dr. Berger?
Well, intermittently, it's more fun that way. Go ahead.
Okay, all right, so here's a question. Besides Dr. Holmes, does anyone else have a background or interest in geriatrics?
Elshaday, you want to answer that? Oh, I think we momentarily lost her. Elshaday's training is in geriatrics. So I know she has a specific interest.
I would say, just as family medicine, I have trained with geriatrics. I didn't do a fellowship in geriatrics, but I'm certainly comfortable with it, and have an interest in it as well.
Thank you. Any other question?
The other question is, what does Dr. Berger like to do with whatever spare time he manages to find?
Dr. Berger loves to watch sports. Dr. Berger is deeply saddened that he can't watch his nationals play baseball and defend their title. He also likes football. He also likes college basketball and is a big Georgetown basketball. Dr. Berger loves to read all sorts of things, from history to biographies to sports books to anything in between that's interesting. Typically, if I read, my wife doesn't talk to me, so it gives me some free time. And Dr. Berger is also a huge sports card fan. I collect old baseball, football, boxing, and basketball cards. And I started the collection as a kid when I would go to camp and flip cards and go to camp with 20 cards and come home with 200. And I saved my cards. And about 20 years ago, one of my patients in their will gave me a box of cards, and it got me back into baseball cards. And so I buy, sell, trade baseball cards and its cousins all the time. That keeps me busy.
All right, we have, you have a lot of hobbies, Dr. Berger, I have to say. So we have two quick questions. One is, maybe I can answer this. Should I wait until Dr. Silverman retires, or should I pick a new primary now? Actually, Dr. Berger, I don't know if you have good advice on that. I think it could go either way.
It doesn't really matter either way. What happens is Dr. Silverman is on a reduced schedule. He's only seeing people in the afternoon, but you're welcome to stay with him until he retires. And after he retires, then you can pick someone. And the nice thing is all the records will transfer. Everything's there. It'll be very simple for someone to get used to it. I know it's very difficult, and a lot of people have been with him a long time. When I joined the group in 1993, Dr. Jones, the founding partner, had been in practice for 42 years. He retired 2 years later, and I, as one of the newer partners, inherited a lot of his patients. And the first thing I said to him is, I said, Dr. Jones has had you to last 20, 30, sometimes 40 plus years. I said, I'm not Dr. Jones. I can't be Dr. Jones, but I said, he had you the first 20, 30 years. I'll try for the next 20, 30. I actually have 2 of his original patients who both started with him in 1952. Both are in their late 80s now. And this is not a husband and wife, it's 2 separate patients. And both of them in 68 years have now had 2 doctors. That's our goal, is to for continuity. The advantage of picking one of the younger physicians, one, they're more available and they have smaller panel sizes, but two, they can be with you for a long period of time. We encourage continuity, and there's a huge advantage when you've seen a patient for a long period of time and you can immediately look at them and go, they don't look so good, or boy, they're doing really well. Is there another question?
Thank you. Just quickly, I just wanted to say, for those of you who are asking about, because I'm getting some comments from our other doctors for that question of should you overlap or wait till Dr. Silverman's gone. As you guys know, we're doing virtual visits right now. If you guys could figure out this webinar, I can assure you can figure out our the technology for the virtual visits. If you want, you can do like a meet and greet or some kind of a quick visit with one of the doctors and see kind of one-on-one how your patient doctor chemistry is. That's an easy way to get to know them. But go ahead and overlap. I mean, I think I've been with the practice now 3 years, and I can tell you that it's nice if you maybe met somebody a few months before somebody retired, and then and for something quick like a back pain or something that's acute, and then later when they come in for their physical, you've met them before. So I don't think you need to necessarily wait to overlap. And then let's do one more question and then get back to our little interviews, and we can come back to questions at the end. But a question that I think Dr. Council will probably get a lot, and some questions people are wondering is, can you explain the difference between family medicine and internal medicine for patients who have, say, been seeing Dr. Silverman for a long time and are used to seeing an internist?
Well, family medicine and internal medicine, both very similar, both primary care professions. It's just the residency training might be a little bit focused a little bit differently. With family medicine, it focuses on the entire family. So from newborn all the way up through geriatrics. With internal medicine, it's usually 18 and above that it kind of focuses on more so. But family medicine just kind of focuses on the entire family. I think that's probably the main difference.
Okay, all right.
All right. Now, I'd like each of you to describe a time in medicine where you were really glad that you went into medicine because of either something someone said, did, an outcome, or something. Go ahead, Dr. Council.
Jeez. Okay. I mean, I think just in general, just with patients, being happy that you're there to listen to them, and patients just saying like, being appreciative of that. One thing particular that comes to mind is that I did have a patient who came from a long flight. I don't remember from where, I think from Vegas or something. And she came to me with just calf pain. And there was asymmetry, or the sizes of the calves are a little different. And so I was concerned for DVT, sent her for a stat ultrasound. It did show that it was an extensive DVT of the entire leg. And she actually, when she went to the ED, actually showed that she actually had multiple pulmonary emboli. And so she came to me about a month, and turned out that she had like factor V light and all these other things kind of came out later on. She was on birth control. But she came to me a few months later and said, essentially, you saved my life, because she had no idea. And so that made me feel really good to know that, being able to recognize that. So that sticks in my head right now, I guess.
Thank you. Dr. Holmes.
That's a really hard question for me, Dr. Berger, because I love medicine. And so I'm literally living the dream every day. But I guess I would have to say, actually right now for me is one of the reasons why I'm very happy to be a physician. This has been a scary time, I think, for all of us, with the pandemic, and being able to talk with patients and being able to do things virtually, just the novel of technology. I find myself really enjoying my profession, where I feel that I'm able to talk with patients and kind of help alleviate some of their concerns and fears, and make them feel more comfortable in this quote unquote new normal that we're having. And so for me, this time right now, I think when I think about my 7 years of being in practice right now, I would say kind of trumps all of my everyday moments.
Dr. Sam.
I agree with Kharia. I mean, the virtual visits have been really, really good because so many patients are worried with the current pandemic, and especially when it's kind of increasing during these days. We're reaching the peak pretty soon. Just being able to talk to them and say, okay, this doesn't look like what you're worried about, and just allaying their fears, it's been very rewarding. So I've only been in practice for about 7 months, but right now I think this particular period has been very, very rewarding in terms of dealing with patients and making sure that they're okay.
Elshaday. Loser again? I briefly, for the people.
She's there.
Got her?
Hello?
Elshaday.
Yes. So sorry, I had my thing muted. For me, almost every day I go see a patient, and when I listen to them and when I get the real communication, they tell me their honest feeling of why they did not take their medication or whatever their anxiety is. And at the end, they feel better, or their blood pressure is managed, or anything that I'm making a difference on. That makes me feel so good at the end that this is why I chose this career. So it's just the communication, the everyday communication I get to have with the patients that gives me meaning.
Thank you. So just a few other little thoughts. We have, a couple years ago, we actually took a survey of all the practitioners and staff in our office to see how many different languages we had at least one person fluent in. It was 18 different languages. One of the reasons I love this area is the diversity, the options to try different cultures, different foods. I tend to agree with Dr. Council on that one. And the diversity of our patients. We'll have patients who you'll see on the news, and then we'll have patients that need samples to get through the month to pay for their medicines and everything in between. We tend to have a very bright patient population, and which makes our job easier, except for the few times when they come in and said, I Googled this, or I heard on the radio that, and then we have to sort of explain things. Let me give a free question this time for each of you to say any one thing that you want to say about yourself or the practice hasn't been mentioned.
Can I interrupt here for a moment?
Please.
Okay, so just Dr. Holmes has a comment, so I'll let her speak. But in terms of things that haven't been said yet, two quick things. All of these doctors are in the Rockville office. I don't believe any of us on this panel go over to Olney, since that's a very tiny office with just 2 doctors and 1 nurse practitioner. And then if Dr. Holmes and Dr. Sam, when you guys are going around now, could just repeat your specialties or your interests. I think some of the patients missed that, and that seems to be a repeat question on the chat. If you guys could just say those things again.
Sure. Should I go first?
Sure.
Okay. My specialty, like my interests are nephrology, which is kidney disease, and infectious disease. So those are the 2 main topics that I'm very interested in.
But you also do general medicine.
Yes, in addition to that.
Okay. And Dr. Holmes?
So my, I guess specialty is really just the whole patient. I see everyone from 18 on up. I did a fellowship in geriatrics, so I do have a passion for geriatrics, but I did not want to become pigeonholed into just doing geriatrics, because I feel as though in order to take the best care of patients, it's important to know kind of the things that they are in line for as they get older, and the best way to have and live the best, healthiest life that you can is to be proactive. So I'm really passionate about all of it in preventative care. I believe I'm kind of I try to be a one-woman stop shop for most patients' things. So I do women's health as well, as far as pap smears, breast exams, and things like that, just because time is sometimes short and having to take time off to go to the doctor and multiple doctors is difficult. So I try to handle as much as I can for the patient within the scope of practice that I have.
One of the things I'd like to say is I'm the point person for new doctors hiring. And what happens, the process is we have a person in Privia who facilitates the process. They will forward us CVs. We will look through CVs, decide who we're interested in. We'll do a phone screening on the CV, and then the people we like best are interviewed. It sort of works out for every 25 people that we get a CV for, we probably do a phone screening for maybe less than half. And of the ones we do the phone screening for, probably maybe if we do a phone screening on 10, we'll probably invite 2 or 3 for an interview. And if we invite 2 or 3 for an interview, we're going to pick the best one. So we've been very fortunate to get very good quality practitioners here, and we've been very happy. And our goal, as I tell everyone when they come here to interview, is if we hire you, our goal is to have you retire with us. And our goal for our patients is continuity, long-term care. You know, there's a big difference between you go to a place where you see a different practitioner each time, or you go to an urgent care to treat a specific problem, but they don't look at you at the whole. They just say, I got to deal with the sinus infection of the UTI, but not why is this their 3rd one in the last 6 months or something. And so there's something to be said for continuity, picking a doctor, being comfortable with that doctor, and continuing with that doctor. So now I will ask each of you if there's anything specific that I haven't asked. Dr. Holmes.
So I just got a message, I guess, asking how geriatrics differs from internal medicine. And so I just kind of wanted to address that because I wasn't sure if that one came up. But how geriatrics differs from internal medicine is in the thought process that you take. So in looking at a geriatric patient, I start having to balance really the risk versus the benefits, in addition to quality of life and quantity of life, in looking at medications and things of that nature. It also differs to me from internal medicine in that you really get an opportunity to have more in-depth discussions with the patient in regards to what their goals of care are, irrespective of what the recommendations are. So when I start having conversations with patients about screenings, for example, we start talking about, do we want to still do mammogram screening? Do we want to still do PSA screenings? Do we want to still do colonoscopy screenings and things like that? And we always balance it in conjunction with all of their other health issues, in addition to what their goals for their end of life come into play. So that's one of the things that I find that's different for geriatrics. One of the other things that I find that's different in kind of focusing on the geriatric patient is you also get a lot of input from family. So a lot of my geriatric patients will come in with their loved ones, their daughters, their sons, their nieces, nephews even. And so it really kind of becomes this integrated approach of how to best take care of mom while all of these things are going on, and you get input from the family as I've seen this and this, and I've seen this. And so that's one of the things that kind of draws me to geriatrics.
Next question would be, let's pretend that there's a new patient coming to see you, whether from within the practice or outside the practice. What would you tell the patient of what you should bring or be prepared to, what information you should have for the first visit? Start with Dr. Council.
A list of medications, or bringing the actual prescriptions with you, the name of your pharmacy, emergency contact information. That's probably about it. Bring yourself. That's really it. The main thing that I would need is just knowing the medications that you're on. Of course, we want to get medical records from previous provider, but I wouldn't expect the patient to come with that. So that's something that we can kind of on the back end try to have the patient fill out a record release form, or in advance, the patient can have their former primary care doctor send that over to our office so that we can have those records. But other than that, if they have any other records at home themselves, they're certainly welcome to bring that. But the main thing I think would be making sure that we have those medications.
Does anyone have anything else to add to that? I would add that, I'm sorry.
I would just add patience, just to bring patience with you in realizing that I'm not going to be able to in-depthly know you in one visit. So just be patient as I get to know and maybe have to ask questions several times in different ways to kind of get at what it is that I'm looking for. Patience, I think, is also key.
Thank you. Dr. Tano, is there any other questions at this point? No. Okay. I'll tell you what.
Sorry, I didn't realize I unmuted. So some questions about this is more of a technical question, but how do patients sign up to get a new primary care doctor, and what is the process of scheduling a physical with one of these new doctors?
The easiest way is just to call the office and the staff can arrange that. If they're an established patient and they're due for a physical, they can just set up a physical. If they're a new patient that has not been seen here before, we typically prefer them to do a new patient get acquainted visit where we learn your history, find out things, and have you come back a second visit for the physical because we sort of need your old records, your old labs, and everything else to put it in context.
And then
Some more chats on here that I wanted to read out.
I'm sorry, go ahead.
There's someone asking, I scheduled a wellness visit a while ago with Dr. Silverman for April 22nd. Should I cancel until the coronavirus pandemic subsides? That's a chat that was popping up.
You may answer that.
All right, so I think a lot of us, including Dr. Silverman, is doing virtual visits. So a lot of the wellness visit can be done virtually. So I'll suggest maybe clarifying that if he does it, and I believe he does, and keeping it the way it is.
Thank you. Dr. Tano?
Yeah, so we have a few questions here about our doctor, Dr. Liu, who is out on medical leave. I know that some of you guys are on this chat because you're trying to figure out what to do since she's been out for a while. And what the practice is going to do is going to send an email in the next few days with a little bit of an update of what to expect. Her goal is to return later this year when when her health is better. And of course, she thanks everybody for her well wishes. The first few weeks that she was out, we were getting numerous cards a day of people sending in kind thoughts, and it was very nice. However, she does not want you to wait for her return because obviously it's been some time and your health is important. And since we don't have a definitive date of her coming back, to go ahead and schedule with one of the new providers. And then when she is back in the office, then you can always transfer your care back to her. But because we don't know exactly how long that will be, to just go ahead and establish with one of the new providers at this time. But again, I said a letter will be sent out from the practice with some more details. So go ahead and schedule with one of the new doctors.
Any other questions from the viewers?
Do the new providers have board certifications? I'm laughing because, of course, but go ahead and share that, Dr. Berger.
Yes, I am board certified.
Dr. Council, yes. Dr. Holmes, yeah. The answer is yes for everybody.
I'm board certified.
That makes it very easy. Yes, we are all board certified. Is there any other question?
Yes, there are some questions. There's a question about, do any of the providers have experience dealing with employment-related issues, FMLA, and other kind of leave that patients might be anticipating around this pandemic?
I think the answer to that is we all deal with it. All of us have had to deal with forms for FMLA. So that's not a provider-specific thing. It's based on your health, your occupation, your risk, and we're happy to complete forms that are needed as long as it's truthful. That's not a provider-specific. Any of the providers in the group are capable of doing FMLA forms.
Okay. I mean, there are more questions. Dr. Berger, did you have any other questions you wanted to ask the panelists, or?
Go ahead, finish the questions there.
So there's a question for Dr. Sam about your training and how you said that you trained with a lot without doing a whole lot of diagnostic testing. So the question is, without blood and urine tests, what kinds of screenings do you routinely do?
Oh no, that was in Sri Lanka. So when I said diagnostic testing, there was really CTs and MRIs. So imaging, routine blood work, urine, everything was available there. So for example, if someone comes in with appendicitis, we wouldn't immediately do a CT scan. It would be based on the symptoms, and then we'd come to a diagnosis without really relying on imaging. But everything else is pretty much the same back home.
Okay. And what age do we consider a patient to be geriatric?
The older you get, the older that age becomes. My personal definition is I tell my patients they're allowed to, I give them the speech. I tell them when they turn 90, they're allowed to calling themselves old. In their 80s, they're just later middle age. I tell people when they turn 99, I give them the talk. The talk is that I expect them hopefully to have good quality of life and turn 100 and have a big birthday party with a nice piece of cake. And I tell them that their first visit after 100, I expect a small piece of that cake. To date, I've received 13 pieces of cake. The most recent one was last month. So everything is subjective in terms of old. I have people in their 80s and 90s that are much younger. Some of my patients in their 50s and 60s. So age is relevant.
Okay, thank you. That is true, that it is a moving target as you practice longer. Question, if my parents are current Dr. Silverman patients, do they need to do anything with their medical records in terms of transfer? And so the answer is no. If we are all in this practice in RIMG, we can see your records. You don't need to do anything. And then similarly, people are asking how to formally switch from one doctor to another. If you can do this either at a visit where we, in our system, will change your primary care doctor to be whoever the new doctor is. Some insurances do require you to update them on a formal new primary care doctor. So if that's the case with your insurance, you might need to let them know. But as far as we go, as you can just confirm this switch. We have a patient here who is already a fan of one of you and wants to make sure that that patient is scheduled with that, is confirmed to switch to that doctor. So as soon as you schedule that visit, if you're scheduling the visit with the intention to establish care with the new doctor, then the primary care doctor is updated in our system.
Anyone have any other questions?
Do any of our doctors or Elshaday have anything else to say? Any other comments?
I'd like to thank all.
I guess to add on, I think what I really want to say is, as a nurse practitioner, my job is to make you feel comfortable, listen, and work with you to get an optimal health. But you're the solution at the end of the day. So we'll have to work together to come to the goal that you and I have to set together. So the first meeting would be to find out what exactly my plan or my goal might not be the same thing with the plan you have as a patient. But we have to come together to come up with a plan and work together to reach that. So you're the solution is my my goal.
Thank you. I'd like to thank all the doctors and nurse practitioner for participating. I'd like to thank Dr. Tano for hosting. And I'd like to thank all the listeners out there who were patient enough to tolerate us. Thank you very much and have a good night.
That was easy.